the support groups in these last few months. And what has been a recurring theme is that, yes, we talk about myeloma, but there are always so many questions about COVID-19. And so we thought that for this meeting, it would be great just to summarize where we are with the COVID-19, the status of the vaccine, and some of the other details. And so I hope that you find this useful as a summary of kind of where we're at and what are some current recommendations. So Robin, if we move forward.
Yeah. Okay.
And so this first map of the world with the darker colors showing where we have a lot of COVID infection, it does reflect what you hear in the news every day, is that COVID is still a major threat around the world with very, very high case numbers in many countries, particularly in Europe. I'm sure you've seen the news in France, also in a number of other countries in Latin America, but also high levels both in the US and Canada, as you can see there. And so we are particularly fortunate in the US in that the vaccines have rolled out strongly, as you know, past the 200 million vaccination mark just the other day. And so we are very, very fortunate that that is helping us to stay ahead. However, in these places where the COVID-19 is active, this is a source of new infections, what are called these variants, like the B117 variant, which came from the UK. The Scottish people like to point out that it didn't come from Scotland, it came from England. It came from the south of England. So it's the English variant, B11. Anyway, but it is a threat. But fortunately, the vaccines, particularly the Pfizer and the Moderna, do seem to give some pretty strong protection against that. But we're worried about a number of other variants that are popping up in these places where the virus is active, and even in different parts of the US, including California and Florida, and different places where the disease has continued to be active.
I'm looking at Australia, and I think we should all just consider going there.
And New Zealand, yeah.
In New Zealand.
Yeah, well, some places, and also you can see Iceland is pretty nice too. That comes with its own challenges. The interesting thing is that in New Zealand and in Iceland, where they've really, really kept the infection at bay, now to get protected, everybody needs to get vaccinated because, you know, they've not been exposed to the infection. If they were to come to the US, they would definitely be at risk. So the key thing in those countries, like Iceland, New Zealand, also Taiwan, is to get the people vaccinated so that they can get to be protected. And rolling out globally is definitely a challenge. So next slide. By the way, you can see I've given you the link so that you can track this information. So the COVID data tracker, again, I've given you the link for this. This is a helpful thing where you can keep track for your group. And it tells you, so if you look at the top left, the number of cases of COVID in the US is over 31 million. So many people have developed COVID. The only good news about that is that means that you can kind of add that to the list of patients who've been vaccinated, so that means that it helps us to move a little bit closer to what's called herd immunity, which I'll talk about a little bit in a minute here. But if you look at the table over toward the right, the people vaccinated, if you look at the bottom column, you'll see the percentage of the population over age 65 that have been vaccinated, 81.5%. So really fantastic. So if you stick with the older crowd, you're in pretty good shape. But watch out for some of those younger people. The percent of the total population is 42%. You can see a percent of the population over 18. It's now it's going up every day. It's around 54%. So we are moving into a pretty good range, which should allow us to have the spread of the infection shutting down. But still, in some parts of the country, there's quite a bit of infection out there in the community. But I think it's helpful for your group. This is the summary, but if you go to this site, it can give you more details for your own different part of the country, okay? Next slide. So everyone wants to know, if you're a myeloma patient, should you get vaccinated? And so absolutely yes is the straightforward answer, particularly for the Pfizer and Moderna vaccines, which are 94, 95% active, very, very great vaccines. And for them, there have really not been any serious complications that really are of concern. Now, I'll be interested in any feedback. We have been watching for this. There have been some patients where they've noticed that their protein levels or their myeloma protein levels, or especially a number of patients have noticed that their free light levels will go up a little bit in the test after the vaccination. So there's been a slight bump in numbers for some patients, but then they have gone back down. So we don't have any indication that the vaccination either triggers the myeloma and does not trigger like smoldering myeloma or something like that, which is the good news. The difficult news for myeloma patients is that when you're taking treatment, there's no doubt that that does reduce the antibody response. And so it's definitely not in that high optimal range that you read about where you want to get to that level. However, a good piece of news is that even if it's at a 30 to 50% level, so not what we really want up higher, that does seem to be enough to really reduce the risk of hospitalization and getting really sick. And so even although for myeloma patients the antibody response is maybe not as good as we'd like, it is probably good enough to give a reasonable degree of protection, certainly for serious disease. Now, are there any things that you can do to try to make sure that your antibody response might be as good as it could be? Well, use some common sense. For example, if you're taking DARA, do not get vaccinated the same day as your DARA shot. That's probably not the good thing to do. Try to do it, as far away from the shot time as possible. And the same is true if you're taking Revlimid maintenance. Get vaccinated on the week off. When you're, not going to suppress the response. And however, don't go overboard. And you do need to talk to your own doctor. And because we don't have a huge amount of data, different doctors have been giving different, sometimes very strong recommendations. Some doctors will say, oh, well, what I want you to do is to actually completely stop your treatment for a month or two. I think that is kind of getting overboard. I think that for many of you, I think that you realize the top priority is to keep your myeloma under control. And if your antibody levels are a little bit suboptimal, we have to live with that. But number one, we want to keep your myeloma in shape, okay? Next slide. So thumbs up for vaccination. And then here, you can populate these slides, Robin. Just go ahead and fill them in, yeah. So a number of places across the country, you can get your antibody levels checked. So you can get it basically 3 weeks after the first dose or the second dose. It's good to check after the second dose if it's the Moderna or Pfizer. And we don't have a huge amount of data, but as I say, the levels have definitely been coming back lower than we would like. And the upcoming recommendation, and some of your doctors may have been talking about this, is it's highly likely that for myeloma patients and all those with immune compromised situation will be recommended to get a third shot, a booster. And it may be that by the time that's available, so obviously right now, everyone is getting vaccinated for the first time. And so that needs to be completed first. But so by the early fall, it could be that we'll have enough vaccine available that this third booster would be an option. And so certainly myeloma patients would be at the front of the line to get that extra booster and to get that extra protection. And it may be, we're lucky that for the Pfizer and the Moderna, the technology allows you to switch out the vaccine so that it will be active against this B117. And so Pfizer and Moderna have both started their trials with the next generation vaccines that would cover the new variants. And so this is going to be a pattern for the future. I anticipate that there's going to be your annual COVID vaccination, I'm afraid, and probably kind of like the flu, it's going to be the new update. It's going to be against whatever the variants are that seem to be dominant at that particular moment. Next slide. So Pfizer and Moderna, excellent. You've probably been seeing about the J&J in the news. It was in a pause because of the blood clot situation, but got reapproved with a warning label. You may have seen that the blood clots were happening in younger women. The ages of the first cases were between age 15 and 48. So really, this is not going to be a common problem for most myeloma patients. For women, there seems to be a higher risk. We don't really know why, but it's quite rare. And now we understand it a little bit better. It could be more manageable and probably treated successfully. Now we kind of know about it. But so for men, I think it's probably fine to get the J&J, and it's certainly simple. It's not a live. There was some crazy news out there that the J&J was a live vaccine, which it certainly is not. It is a single shot, which makes it easier for people who live more out in a smaller community. The AstraZeneca, I don't believe is going to be broadly available in the US. It seems like the US has actually sold their AstraZeneca vials to other countries, which is probably just fine, I think. We'll stick with the other ones because it did also have a blood clot risk. But the main thing for all of those is that they keep you out of major trouble with 100% reduction in hospitalizations and deaths, okay? So I strongly recommend it, and hopefully many of you have been able to get them. Next slide. Oh yeah, you get your little COVID card. Yeah, so many of you will have this little COVID card where you've got your first shot, your second shot, and it is important to keep these cards. People say, well, should you get it laminated? Possibly, but make sure you know that the laminator doesn't like burn it and then you lose your card completely. It might be good to take a photograph of both sides first if you want to laminate it, or maybe put it in a little meeting pocket holder where there's no risk of serious damage.
You know, Dr. Durie, I heard someone give a good comment on this. Don't laminate because your boosters may need to be recorded on the
That's correct. Yeah, that's another reason. It's not the last thing, and you'll see there are empty spaces on the card, and you're exactly right, is that the booster will be added in and signed off. So yeah, I don't recommend the laminating. I think so. Put it in maybe a meeting folder, and you actually right now, it may be that you need it like a COVID passport, but for now, it's probably better to keep it home and safe, because when you go out, nobody's asking to see your card, except maybe friends out of interest might like to see it, but you know, it's better to keep it safe probably. Next slide. Yeah. Now, my feeling for myeloma patients is that masks are still quite important. Now, I'm going to get into these new CDC recommendations in just a minute, where Biden came out the other day and took his mask off. And so this is good. And I'm going to talk about that a little bit. But for myeloma patients, just keep in mind that this virus is still in the community, and for many communities is still at quite a high level. And these variants can still be a challenge, particularly for myeloma patients. Be watchful for younger people, because statistically, they're the more likely to be getting infected right now and maybe spreading it to you, because they might be asymptomatic. Younger people are still tolerating it a little bit better, and so they could have it and be asymptomatic, but give it to you. I think traveling, non-essential travel, I still feel it's smart not to be flying around, and still be very cautious about indoor spaces, which I'm going to talk about a little bit more in just a second here.
Brian and I have not traveled in a long, since the beginning.
Right. There was a funny cartoon in the paper the other day where they had this black travel bag on a psychiatrist's sofa, and the psychiatrist is sitting there talking to the bag and saying, "I understand you're so depressed you haven't been anywhere in over a year." Those travel bags haven't been going too far these days. Next slide.
Oh, there we go. No train, no plane.
No, that's right. No, yeah. These are contained spaces where even with your best precautions, I mean, obviously sometimes you have to, and the percentages are still low, but with these variants, why take risks? I think myeloma patients should continue to be on the cautious side. I mean, that's my personal feeling. Anyway, next slide. And I think that you should move up the scale and get the best masks that you can. I've given you the CDC website here, where you can definitely get N95 masks, or a simple thing to do is to double mask, is to whatever masks you have, use 2 masks, and that works very, very well. And you can also not use googles, but goggles. If there's an area where you're indoors and you are worried, you could use some goggles perhaps. Keeping in mind, as I'm going to touch on in a second, is that even although you've been vaccinated, your antibody levels might not be perfect. So next slide. So those are the masks, the N95. So this diagram, I think it's in the CDC guidelines, and I'm giving you the link here. Came out the other day, and I think it does give you helpful things to talk to members of your group. So I'm going to point out a few things. So if you look on the right, all of the green is for fully vaccinated people. Okay, so all the way down there you see green. So that means these are all the activities are much safer when you're vaccinated. But then you'll notice up at the top 4 on this side, they're not wearing masks, but you'll notice all of the others are still wearing masks. So that's the first thing I'm drawing to your attention, which is that even if you're fully vaccinated, and even if you have good antibody levels, mostly the recommendations still include wearing a mask, okay? Now, if you look over on the other side, that's where people are unvaccinated, and you see there the top 3 are also green, and so those are going out for a walk or a run or on your bike with members of your own household. So even if you're unvaccinated, that is a safe thing to do. The outside space is a very low risk of spread. And you can also have small groups in that setting as well. But then as you move down, you'll see all of them have got masks, and then you'll see the activities are either yellow or red. And so my suggestion is that even wearing a mask, the ones in the red are not a good idea for myeloma patients. So that would be my guide. So green is okay with a mask for myeloma patients, in my opinion, except the ones at the top here. The top 2 or 3, probably you can manage without a mask. But then the arrows here, so why do we have these arrows here? That's because that is an in-person meeting. Attend a small indoor gathering of fully vaccinated and unvaccinated people from multiple households. So basically that would be if you were thinking about having an in-person support group meeting. And you can see there that with masks, it is something that you could consider, but it's right on the edge of the red, okay? And so I think that we need to take a look at how can we guide you on that. And so if we go to the next slide, what are things, if you were thinking, okay, with masks, I think it might be something that we would consider. The community level is low. So think about, okay, who was using this room before? What is the current local guidance for masks? Are they still mandatory in Florida? Well, they're not mandatory in Florida, I do know that, but I mean, in some places they are. And then think about the ventilation and the spacing in the room. And I think that as we're moving into the warmer months, and I'll be interested, Robin, I think that Nancy and some others have had some good ideas of how you can get together in patio areas, or maybe have an outdoor picnic, or different things where you just move away from those indoor spaces where we're worried about the ventilation or the spacing or who's been using this room before. And so we're getting to this point where at least we're starting to think about it, but personally, I would be quite cautious. All right, so we're almost done here.
Yeah, Dr. Durie, Nancy did have a really good idea. We were brainstorming for the support groups. What are these things that we could think about? Nancy, could you unmute yourself for a moment and share your suggestion?
Yeah, what was the, I just heard about it, Nancy, so please.
Yeah, check with the facility on what they're comfortable with and your local regulations. That's really important because the facility might not be open. Meeting outdoors at any time is always preferred if you can do that. But you've got to look at a larger room, if they have a larger room, so that you can get spaced apart and have plenty of air movement in those places. So yes.
Right.
Nancy, your other idea, I really liked that. And we were saying if we continue to meet virtually to be safe, whatever our own decisions are with our own groups and our own communities,
Yes.
Nancy, you had said to, you know, people miss being together, and so maybe something they could do in the summer, Nancy.
Oh, that's right. Yeah, I remember we had so many ideas flying around. Here's the idea is meet virtually and maybe twice a year have a gathering, a social gathering, like a picnic in the summer and a holiday party in a large room or something like that.
I like that, because then you're still connecting with the information, but then you're maintaining some physical social connection, which is wonderful.
Yes.
That's great.
And so you haven't seen your members in a year, so plan a nice big picnic somewhere outside this summer, and then maybe for a holiday party, find a place you can get together that it would be safe, because by then it might be a little safer. But definitely
I love that.
summer is picnic time.
I particularly noticed when we have been participating in different group meetings is that a number of groups have been having quite an influx of new patients. And so I think it must be particularly difficult for new patients where they haven't been physically meeting new patients or any patients, And so I think that for the new patients, this is something quite important to consider.
Yes.
Okay, let's keep going. Yeah.
Hey guys. Dr. Durie, I'd like to add something though, because here's a problem I'm having with my group. I'm North Texas, okay? Since going virtual, and I've been really good about running virtual meetings since I think it started February. The problem I have is there's people in my group, both existing members and new members, that are technology enough that don't want to attend virtual meetings at all and are just dying to have an in-person meeting again because for whatever reasons I can't get them on a Zoom call.
Yeah.
So my plan, short term, first off, is I have to go with whatever the facilities required, which is Charles Salmon Cancer Center. Whatever policies they put in place, we will follow to the letter. But
Sure.
I'm probably looking at short term having combo meetings. They're both virtual and in person, where those that are not comfortable or those that are having to be additional cautionary will have the option of always attending my meetings virtually. But those that require it and need it, I'll try my best to work with the facilities and get extra large rooms and do all the social distancing and everything needed.
Right, exactly. So I think it's going to be different all across the country, and so you need to be flexible. And so I mentioned that as one of the common issues here. You are dealing with some people who, you know, are not comfortable with a lot of the electronics, either for, you know, the meetings or for their doctor's appointments, you know, for their virtual doctor appointments. And so I think that, Robin, for your support group summit, you're looking to have a work group about how do we help people who are not so tech savvy, you know, and that's part of the problem that we were just chatting about. Then the other things here, obviously, this has been just so stressful for everyone, and to help people, you know, you're not going to be resilient every day. It's been kind of depressing if you haven't been able to be in touch with friends or family, and, you know, it's definitely challenging. And I'm sincerely hoping that here in the US, with the vaccinations kicking up and with the infection rate popping down, we will be getting out of this in a helpful way really soon. So next slide. Yeah, it can be pretty crazy there. One that I've given this article to a number of people before, I think, but there is a fantastic article that was in the New York Times at the end of March, which gives a lot more detailed guidance related to what you're doing, if you're vaccinated or not. And I think that you might find it helpful just to look at some of the things which are felt to be pretty safe. And this is given with guidance from a lot of different experts. And so they've kind of weighted the things. What are you doing? Is it indoors? Is it outdoors? And then how long will you be in the room? So that the length of the meeting is also important. Will it be more than an hour? And will people be shouting? Discourage shouting, you know, all these little different details. And who will you be with? Will it be more than 10 people? What do you know about these people? All these different things.
I just have a quick question, because we never have rain here in California. But let's say you're doing something outside, you know, where you live, out, you know, out in the place where it does rain, and you all of a sudden you get a downpour.
Yeah.
What do you do?
Yeah, so you need to be prepared for all eventualities. Yeah. So I don't think it covers rain or lightning strikes in the New York Times article, but it does cover a lot of other stuff. Okay, so you get the idea. Quite helpful. And then I think these are the main things I wanted to touch on, Robin, as you know. Yeah, so people want to know, you know, when are we going to be done with all of this? And as I was saying, I anticipate there are going to be annual vaccinations. I'm hopeful that by middle of the year into the early fall, we will be getting close to this herd immunity level where it will be safe or safer to be out and about in the community, and where work, travel, vacation, and things like that will become somewhat possible. And one target is the 4th of July. People are saying that by the 4th of July, you know, you'll be able to have people over for a barbecue, hopefully, you know, that setting some short-term targets, and then maybe able to go on vacation in the fall, possibly. But you'll see down at the bottom here, it's like that computer program that is a little bit large. COVID pandemic is a big pandemic, and it's taken a little time to load up the future. I don't know. I mean, we just don't know where this is all headed. I do think, unfortunately, that the fact that vaccination is slow in a lot of countries around the world, it means that we can't really return as a global community until we take care of the COVID in other countries, you know, and you've seen the mess that's going on in India right now, as well as, you know, in some of the other countries in the last few months. And so not only is that a tragedy in itself, all these people getting sick and dying in India, but I mean, it means that as a global community, we're still going to be at risk for quite some time. So anyway, yeah, it's a little shaky, and that's not just because we're here in California. The future, we have it set up here where it's a little shaky. We'll see how that works out. Okay, I think we're done there, and I hope that this has been helpful. Just to give sort of a broad background when you get all of these questions, and a lot of detailed questions are sometimes difficult or even impossible to answer, but you just got to do your best.
Dr. Durie?
Yes.
Question. Patients who are undergoing general anesthesia for different kinds of treatments, myeloma patients,
Right.
they're in a situation where they're not masked in because of the particular procedure, and they're kind of, you know, in a 1 hour or 2 hour surgery. Right. Do you feel that the healthcare institutions are safe enough now that those kinds of things can happen without a lot of concern that you're overexposing yourself to risk?
Right. So really good question. I think that these kinds of things are largely safe. So let's start with the basics. So broadly, infections are mostly occurring in the community, not at the hospital or in the clinics. And that's because now the safety precautions at your hospital and your clinic are really rather strict. I'm sure you see that. I mean, even separate entrances and different things like that. And everyone that you come in contact, up to now at least, been wearing masks and taking great care. And so the staff have mostly been tested frequently on a very frequent basis. And so in general, it's pretty safe to have a short surgery. To go to a dentist office, for example, kind of a similar situation where sometimes they'll use like a short-term anesthesia if they're doing a procedure. Those dentist offices are actually, the dentistry profession have taken this extremely seriously and have set up some very, very careful national dentistry guidelines. And so I think in general, on the medical side, relatively safe, I would say, okay? Okay, thank you for that. Any others, all right?
Dr. Durie, on the topic of dentistry, Monday, the speaker from my group is one of the dentists who discovered ONJ and wrote the first paper for the medical community on it. He is a past president of the American Board of Oral Medicine. He's a former faculty member at my university, and he's the associate dean for clinic administration at the University of Florida. So if anybody would like to listen in, send me an email.
No, that's great. Yeah, no, he's a great guy. I worked when we were first getting so anxious about ONJ. I was in touch with him. It's Dr. What's his name?
Cesar Migliorati.
Okay.
He knows you. He knows you.
Oh yeah, yeah. Because we worked in the early days, but I'm sure he can give you some really good tips related to dentistry. But I'll be interested. But my feeling is that it's largely safe because of the. They are among the groups of doctors among the most careful, I believe.
Yeah.
Okay.
His primary topics will be ONJ and other oral care issues cancer patients face.
All right. Thank you.
Okay, so I'm looking over in the chat box.
Yeah, there's a quick question, Robin, in the chat box, and I've had this before. Are the Pfizer and Moderna interchangeable? For example, if we need a booster, does the brand make a difference, or do we need to stick with the same brand?
Right. Yeah, I think if possible, you should. We have no data on switching brands, but they are slightly different. Probably it's if it had to be done, it's probably good. It's better to take a booster than not take a booster. You've probably seen in the news that some people have been skipping the second dose, which is not good. You really need that second dose in the correct time frame to get that extra antibody level up. So, I mean, if it meant that, you know, you got the Pfizer, but there's no Pfizer available, maybe you could take the Moderna, but it's really not recommended. And we have no data, unfortunately, but based on the mechanism of action, it should be pretty good, but they're not identical.
Okay.
Yeah.
I'm looking in the chat box as well. So I'd like to respond and let all of you know that yes, these slides will be available, and even better yet, we're recording this. So we will put this up on the Support Group Leader Toolkit for you to use if you want to use it on your next virtual meeting, so you can have good discussions with your own members as you're planning. That would be really helpful for all of you. Some of the other questions in the chat box that I'm seeing, Dr. Durie, are about when will we know what that antibody test results, what do they mean?
Right. Okay. So I didn't touch on this, but there are two types of antibody tests. There's one antibody test which is related to whether you've been exposed to the infection. And so that's the widely available test. And that's the one that, you know, we were looking to get when we were at the beginning of the pandemic to see if people had been exposed. But now, related to the vaccine, the antibody test that we want is the neutralizing antibody. So the neutralizing antibody test. So we're interested in the antibodies that can actually attack and neutralize the virus. And so if you see that, it has to be the neutralizing antibody, okay?
Okay, and then a lot of people are asking, Steve, would you please in the chat box put in what your email address is? People are very interested in the ONJ program. And also leaders, don't forget, when you have major speakers that you know other group leaders will be interested in joining or inviting their members to, on that Support Group Leader Toolkit, we have that speaker forum. So you can add that there. So two things, don't forget to post and don't forget to check to see what's there, okay? And if you need help with the toolkit, contact John Fitzpatrick or any of the support group directors.
Okay.
All right. Oh, here's a question on where do we get antibody testing done?
Well, talk to your doctor about it. A lot of the centers around the country are offering them now. So ask and see if you can get it done. Yeah.
Brian, somebody just asked if you could get your slides.
And yeah, they can have the slides. So Robin, you have them. So I don't mind them being distributed. Okay, yeah. That's okay.
Yep, exactly. So both are going to be available, the individual slides as well as the replay and the recording.
Right. Okay, so no worries. We're happy to do that. And yeah.
Okay, I don't see any other questions in the chat box. Oh, here's one more. How long do the antibodies last? And is it different than getting actually getting COVID-19?
Right. So the initial testing showed that vaccinated people had good antibody levels at 6 months, which was actually the longest, you know, that was available at the time. It was that 6 months follow-up. So we know that pretty good levels persist for at least 6 months. Another interesting thing, though, is that if you have had COVID-19 and recovered, should you get vaccinated? And the answer to that is yes. And the reason for that is that in some patients, and I suspect this would also be pretty true for myeloma patients, is that although you maybe got over the infection, your natural antibody levels were not so high. And so when you get the vaccination, it gives a big boost to the antibodies. And so there are some people who have this long haul, the long haulers. And so what was discovered is that when the long haulers got vaccinated, about half of them, the long haul thing cleared completely up. They were having all these symptoms and headaches and aches and this and that. Very problematic for a number of people. But when they got vaccinated, about half of them got better because they developed higher levels of antibodies sufficient to clear the infection. And so both aspects of that are quite important.
So another antibody is a hot topic, Dr. Durie. So we've got another one on if you do get the antibody test, what is a good percentage?
Well, after one dose, 30% would be good. If you can get into that 50 to 70% range with after the second dose, that would be excellent for a myeloma patient. We're really not expecting you to get up to the 90%, frankly, if you've had active disease. In a recent study, there were 3 patients that actually did have higher levels, even above 70%. And those 3 patients were in a full remission and off all treatment at the time. And they were able to mount fairly normal antibody levels, even above 70%. But okay, so I hope that's helpful.
Yeah, no, that is helpful. I've got a leader asking a pretty typical question, and it is a little bit challenging. So the question is it appropriate to ask our group members if they've been vaccinated before deciding to go indoors for a meeting? And I think there's some privacy concerns about asking if people have been vaccinated.
Yes, but I do think that safety does override that. I mean, I think that, as you know, a lot of businesses and things like that are starting to say, you know, yes, you can come on in if you're vaccinated, you know. So you can choose to come to the meeting or not, but if you do come, you know, you got to be vaccinated.
I'm on with the conference
So
call.
I think that it may be a delicate point, but
okay.
I think that it's serious enough that we're going to see more of that, where people will ask if you've been vaccinated. And we were talking about the vaccination passport, the little card thing. And I think that, you know, people, it's a little bit controversial, you know, to mandate, and certainly like in places like Florida, it might never happen. But I mean, you know, we don't know. I mean, I think that many places are going to want to see your little passport card.
Yeah, and I think that gives you and your members a level of, you feel a little safer. Maybe it reduces the anxiety of being back together, especially if you're inside in closer quarters. But again, thinking about the spacing of your meeting and how much room you have to space out appropriately. And again, if people are wearing masks inside, I love that graphic that Dr. Durie you had with the green and the green, yellow, and red and the masks.
Right, absolutely. And this is just a small point, but older buildings in general are not as safe as some newer buildings where they're able to upgrade the ventilation. But I mean, if you meet in an old church hall, ventilation's probably not so great. You know, and it used to be you want to go to that old antique hotel, you know, ventilation probably not so great. And so just keep these little things in mind about your meetings, and outdoors whenever possible as we move into the warmer weathers where the level of safety is so much higher. I mean, the percentage spread in outdoor spaces is in the 1% range or less. I mean, the risk of infections outdoors is way low.
So that's good.
That's why you're making me sleep outside.
Yeah. Susie's been sleeping out on the deck just to be really safe.
You still have the tent out back, Susie? No.
Yeah, there you go. All right. Well, I don't want to overdo on this, but there always have been so many questions that we thought it better just to focus on that before you launch into your other program items here.
Yeah, we have a few other topics to go over, and this was really, really very, very helpful. And John, we could probably